Welcome learners in this session on blood sugar monitoring. Talking about the definition of blood glucose monitoring. Blood sugar monitoring is also known as blood glucose monitoring. Blood glucose monitoring observes for patterns in the fluctuation of blood glucose levels that occur in response to diet, exercise, medications, and or pathological processes associated with blood glucose fluctuations such as diabetes. Usually, high or low blood glucose levels can potentially lead to acute or chronic life-threatening conditions. Blood glucose level or blood sugar level monitoring undertaken in the home or community are often referred to as capillary blood glucose tests, while blood glucose tests carried out at clinical facilities may include capillary blood glucose and venous blood tests. Types of blood samples: capillary blood or venous blood. So talking about the two types of blood samples, first being capillary blood. A blood drop sample is usually collected from a fingertip prick. Blood samples can also be sourced from alternate sites such as the earlobe, heel, forearm or palm. Using alternate sites may be less painful but may need a deeper lens. The second blood type of blood sample is venous blood. It is collected via venipuncture and the sample processed in a commercial grade laboratory with appropriate sophisticated quality control checks. Capillary blood glucose monitoring has both its own advantages and disadvantages. Talking about the advantages of capillary blood glucose monitoring, it requires a small blood sample. Range of alternate sites is available that is capable of testing. The testing time is very short. Large display is available on the glucometer, and this is less painful than a venipuncture. Talking about the disadvantages of capillary blood glucose monitoring, manufacturers often provide low cost or substandardized or subsidized glucometers. The test strips are expensive, time limited, that means they may have short expiry dates, and are affected by a range of variables including temperature, humidity, size and quality of blood sample obtained. Accuracy of the result is dependent on the clinical presentation of the client and may not be very reliable in clients with hypoglycemia, anemia, altered hematocrit, hypotension, or those who are critically ill. Older machines may need calibration with test strips and results could be compromised if the calibration is not undertaken appropriately. So these are certain disadvantages of capillary blood glucose monitoring. Coming to the next type of blood sample, that is venous or the plasma blood sample. This type of sample also has its own advantages and disadvantages. Talking about the advantages first, accurate measurement of blood glucose is superior to the capillary blood glucose test. However, this is dependent on the laboratory meeting established industry standards. Coming to the disadvantages, collecting venous blood sample is a painful procedure. There is a risk of local tissue damage and is unsuitable for frequent specimen collection. Coming to the articles required for the procedure, the articles required are a tray containing a pair of clean gloves, glucometer, testing strips, lancet, cotton swabs with spirit, and a paper bag or a kidney tray to discard the waste. When I'll be doing the procedure, I will be showing the tray and the articles which are required for doing the procedure. Coming to the steps of capillary blood glucose test with a glucometer, collect the articles, wash hands, Skin or site preparation is done if required. Wash your hands first. After washing the hands, apply a gentle amount of hand rub. Wear a clean pair of gloves. After putting on the gloves, prepare the device with which prick is to be given. Adjust the lancet into the device. Adjust it up till a particular depth or a suitable depth. Take the glucometer and insert the glucose strip into the glucometer. Remember not to touch the sensor side of the strip. Insert the strip into the glucometer. The glucometer turns itself on. This glucometer is ready to be used. Take a spirit swab. Select suitable site at which prick is to be given. Usually it is the heel in case of neonates and infants. Clean the site using the spirit swab in circular motion. Clean the site using spirit swab in circular motion. Let the first drop of blood come out. Wipe this first drop of blood. Squeeze the second drop of blood and take it on the glucose strip. Let the glucometer give its reading. The reading has already appeared on the glucometer screen. Remove the strip and discard it and keep the glucometer back. Apply gentle pressure over the site at which the prick was made and hold it for a few seconds. The reading obtained now needs to be recorded. This is all about the procedure of blood glucose monitoring. Note that the recommended site is on the palm side of distal ends of fingertips to minimize injury to the bone. Avoid the little finger as the tissue may not be deep enough to prevent injury to the bone. Avoid the index finger and thumb as these are highly sensitive areas compared to other fingers. Heel prick is done in neonates. The site on the heel is the lateral or medial plantar surface for babies up to 1 year of age. Steps of capillary blood glucose test with a glucometer will be continued. Prepare equipment. Prime the lancet to no more than 2 mm to minimize the risk of injury to bone. Priming means setting the depth up till which the lancet will be able to prick. Remove the glucose testing strip without touching the sensor tip from the container and insert it into the glucometer. This often leads to the glucometer turning itself on. Firmly apply the lancet to the site of sample collection. Release the trigger on the lancet to pierce the skin. Recommendations are to wipe away the first drop of blood with clean gauze or tissue as this drop of blood may contain intracellular or interstitial fluid or is hemolyzed, both of which could affect the blood sample. and its quality. Gentle downward pressure applied close to the puncture site may facilitate blood flow and collection of the second drop of blood. Collect the second drop of blood as it forms by touching the tip of the glucose testing strip. Place the glucometer down and cover the site of skin puncture with a clean tissue. Pressure may need to be applied to stop further bleeding from the puncture site. The machine normally provides a result at this stage unless there have been errors in collection, for example, insufficient sample, low battery, wrong codes, or the machine times itself out. If an error displays on the glucometer, troubleshoot as appropriate. Wash hands and replace equipment in storage bag container. Make a note of test results relative to diet, exercise, and or medication use as appropriate. Interpretation of results. In diabetes, HbA1c values will be 6.5% or above. The fasting blood glucose will be 126 mg per deciliter or above, and the glucose tolerance test result will be showing 200 mg per dl or above. The random blood glucose level will be 200 mg per deciliter or above. In pre-diabetes stage, HbA1c value will be between 5.7 to 6.4%. The fasting blood glucose level will be between 100 to 125 mg per deciliter. The glucose tolerance test value will be showing a value of 140 to 199 mg per deciliter. A normal person will have HbA1c level below 5.7%. Fasting blood sugar level will be less than 99 mg per deciliter, and glucose tolerance value will be less than 140 mg per deciliter. Thank you.